everybody. I've been asked not to have notes in front of me. So I was asked to speak without notes. Thanks for making time and showing keen interest in our department. It's one of the most difficult departments that you can run as an individual. We are running a health system that caters for 15.78 million people. Our facilities cater, or the people that walk through our gates and doors, they are 25 million per annum. Just to show you the extent of the numbers that we have, Krisani Banagwanath delivers 25,000 babies per annum. So that's the amount of work that we are doing. And we come again with a very tainted image. Different perceptions have been made, and some of them are even concluded that we are almost going to fail the system. We are in a process of a strat plan. We're in the middle of the strategic plan as we are coming here to speak to you. But it's important that we acknowledge the role that you are playing in society. I want to take a different angle and just reflect a bit on what has been on a debate for the past 4 years about fake news. Fake news, and I think Trump calls it differently. What does he call it?
Alternative facts.
Alternative facts. And with health is that it has become very easy for the media to actually use alternative facts. So part of this engagement is just to establish a relationship between the department and the media, and also say to you as the fourth estate that we are available, we are transparent, and we are willing to be accountable. Above all, we are also available to educate. Some of the facts that we report on are facts that we all agree that they would only happen only maybe in movies, because they don't anyhow reflect the truth. One of the facts that have been there, physiologically and anatomically, it's impossible for a woman to deliver standing. I'll repeat again. Physiologically and anatomically, it is pretty much very difficult for a woman to deliver a baby standing. And I think if you visit archaeology books, particularly those that relate to obstetrics, you will know that evolution, as it progressed from where we come from as Homo sapiens, the better way of delivering of a baby is by squatting. That's how it's supposed to be. That's a better way. It also is facilitated by gravity, and it also gives a woman an opportunity to direct the process, and also a woman to direct the baby. So some of the things that we normally report on or talk about, they become a bit of fiction, and only on the basis that we want to sell papers or to have headlines. So part of this engagement is just to plead with the fourth estate, particularly as it relates to issues that relates to lives of people, that we need to take an extra effort just to verify the facts. So there are a lot of things that have been said about the department, and I've seen a lot of figures that are bandied around CFO about the levels of our accrual and deficits. And we released a statement on our unqualified audit findings, I struggled to find it being covered anywhere. So I'm trying to demonstrate that there are good things that could have been reported on, but because they are not going to sell the paper or continue with the reputational damage that we are coming up with, it's not reported on. So one of these issues, again, is an issue of us trying to build strong relationships. We need the media to educate the public. The media is important as a tool and as a medium to, in essence, educate the public on many aspects. As one of the priorities that we have as a department, which we are hoping that the media will partner us on it, is on the public health education program, which is aimed at not only dealing with health promotion and talking about healthy lifestyles, because statistics have shown that a number of deaths that are happening in Gauteng are actually from non-communicable diseases, which are caused by lifestyle diseases. So we need to have that health program that will promote healthy lifestyles. We also want a health education program that is going to educate the public on how the health system works, where you have to start when you are sick, and unless you are an emergency and from trauma, then you can't start at a clinic that closes at 4. You have to go straight to hospital. But basically, we need to educate people about our referral systems and the role of our institutions. What is the role of the GP in the whole system? What is the role of a clinic? And what type of clinics do we have? And what do they represent? I'm not sure if all of us are quite clued up about it, but CHCs are the only type clinics that are 24 hours. And these are the clinics that we want to make them to be 24-hour clinics and functioning 24 hours, delivering services. And the type of services that we want from these 32 clinics is maternity, which is obviously a 24-hour function. It's accident and emergency, which almost is also a 24-hour function. But at the clinic, we don't want emergencies that are categorized as P1. P1, it means that you need immediate care and your care will require hospital. So we require P3 and P2. And even P3 we don't really want, because it's people that can normally treat themselves at home just by taking a paracetamol. So we want to educate the public about that the primary healthcare clinics, then the clinics that you see are the ones that do the actual work of seeing patients every day up to a particular time, but seeing cold cases, that's what we call them, cold cases. And simple ailments that maybe if they require more attention, then you will be referred to a hospital. So such conversation, these are conversations that we need to educate our public on. Because one thing that we have discovered is that people who complain in hospitals about waiting times are those who are actually well. They are well enough to even have the issue of tweeting the MEC to say, I've been waiting here for 5 hours, I've not been seen by a doctor, and I think I'm really sick. I need attention. And when you find out, you find that the casualty has been busy with a lot of patients that in essence needed immediate attention. But if the patient was at the appropriate level of care, he would have been seen and been treated on time, and maybe during the day, not even at night. So this is a type of conversations that we want the public education, health education that we want to unfold, but the media must be a part of it. The second part of it is about the cancers. We need to talk about cancer so that we also destroy the myth that actually carried through about cancers. In obstetrics or gynae, the real cancers that are there in gynae, it's only the ovarian cancers, those ones that are from ovaries. The two other cancers are cancers that are normally preventable. CA cervix that kills most of our African women, it's actually a sexually transmitted disease. And it is preventable, and there is also a vaccine on it. So it's not supposed to be killing anyone currently in the 21st century. Cancer of the womb, of the uterus, is also related to lifestyle diseases. So women normally who develop it are women who normally have got diabetes, increased BMI, and all those are things that can be sorted out and can work out and be preventable. So these are conversations that the media, so that we are able to educate our public on what should be our responsibility as a community about our health. So it's one of our priorities that we want to talk about. And I think this is what the partnership with the media will be so important. And we are not saying or discounting the importance of us being transparent and for us to be accountable for our actions. And these are things that we need to say. In terms of the next 5 years, we are in a way of trying to prepare or improve our quality of healthcare for the universal health coverage when it comes. And like Dr. has said, NHI is a funding model. It's a funding model that will fund our future and improve our quality of healthcare in the country. Questions have been asked about why do you want to start the new funding now? Fact of the matter is that the public health sector is pretty much underfunded, and there's been a continuous disinvestment over the years in the health sector, particularly the public one. And the medical aids have always been one of the areas where a lot of wastage happens.